Moving on, stigma, finances, nutrition and mental torture remain the biggest challenges cancer patients face in their journey to seeking treatment. While many suffer in silence, various groups of Kenyans of goodwill have come out to lend a helping hand to ease the patient's journey to recovery. One such group is Lady Hope Wellness Institute, which has continued to offer support to cancer patients.
Meet Sarah Wamboi and Grace Kinyua, cancer patients, at the St. Catherine Siena Catholic Church in Nairobi, preparing for a cervical cancer awareness walk. Sarah was diagnosed with breast cancer in 2018 and Grace with cervical cancer in 2019.
Matiti nilianza kuona imeanza kutani black nikiwa na ujauzito wa kitu wiki 3. Mimi nikafikiria ni maziwa inajiform, but haikuwa maziwa. Manases wakaniambia, mom, kuna shida hapa. Fanya nilienda nikafikisha wiki 3 wakaniambia itabidi watoe mtoto wangu. Nikawaambia hapana, mimi nikatoroka hosi nikarudi home.
Ikasemekana kansa yangu iko stage 1. Nikashindwa nitafanya anje, nikawaulizia wakaniambia nitafanywa operation, nitolewa uterus ndio ugonjwa usiende.
Seeking treatment was never easy for the duo amid stigma and financial challenges.
Sasa mtoto saa hii COVID imeingia vizuri kabisa. Sasa hiyo niko na katoto kadogo, mimi fenya niligojeka, nilijipata hivi pwekwe. Nilitegwa na kila mtu. Na niko na familia, watu wetu, relatives. Hadi sijui niseme aje, ni Mungu.
When all seemed lost and hope gone, a good Samaritan reached out to them. Lady Hope Wellness Institute, which on Saturday held a cancer awareness walk to mark Cervical Cancer Prevention Month, as well as raise funds, has been working with cancer patients in solidarity and in treatment.
So we rent accommodation facilities where they can sleep, and we secure transport for them to go for their treatments. We also help them in nutrition. We also hold support groups.
Director Veronica Mwangi says 70 needy patients are under their care.
There is stigma. People think cancer is a death sentence. Even when I started, I walked into many offices, but those I approached, they were thinking that they'll give me money and I'm putting it in the project and the patients are on their way to their deathbed.
Chemotherapy is very draining. Some of our patients do manual labor for earning. So if it's draining and they're doing chemotherapy, they cannot do that. So also the foods that they are eating, they're not helping. And that's why we have a network of young people for blood donations.
The National Hospital Insurance Fund has been urged to allocate more resources in the war against cancer to help those struggling to meet the cost of the killer disease.
If they can actually be able to pay the whole of NHIF, and then now the cancer patients do the checkups, the lab tests and all that, it will really help.
The government should come up with a budget to do allocation for these patients.
Sarah and Grace say they are lucky to be alive. According to a 2021 report by the Ministry of Health, Kenya has one of the highest rates globally, with 40.1 new cases diagnosed per 100,000 women annually. Kamche Menza for the Legends edition.